All right, good morning, and thank you so much for sticking with K24. Shiko Kaitani here with you. What a pleasure it is indeed. Asante Sana for all the feedback, the questions, as well as the salams that we continue to receive through our social media platforms. That means you can catch us as at K24 TV on Instagram, Facebook, as well as X. You do have our WhatsApp number at the bottom of your screen. We always love to interact with you, so karibu sana. You also have my personal handles as well. I'd be most appreciative, FYI, if you like, follow, also subscribe to some of the content that we're putting up on our YouTube channel. This morning we've got a great one for you. This being a Thursday, we're talking about mental health issues this time around, and it's all about common co-occurring disorders. In other words, what's on our tag, what's on your screen is actually what we are on about in very simple terms. It's about substance abuse and mental disorders. What do we need to know? How do these two tie in light of this being Mental Health Awareness Month? We continue to push the importance of mental wellness and how you, by the way, can be of help to someone who needs it. We are so happy this time around to have her back in studio. We're talking about Valentine Kadhambi, okay? Last time she was here, we had such a great discussion, and that's because we were talking about issues to do with your childhood and dealing with the trauma that comes with it. She is a certified consultant clinical psychologist. I keep teasing her about the length of that title, but Kadhambi, welcome back.
Thank you.
It still hasn't shrunk, that title.
No, and it's about to get even bigger.
Okay.
Yeah.
So how do you want us to be introducing you now?
No, I'm just a clinical psychologist.
That works.
That
fine.
works, or a therapist.
Good to see you. Always looking bomb.
Thank you.
Hey, you've got a lover therapist, a brainy babe who knows how to style herself. That fashion is on point.
Thank
it's on
you,
fleek.
thank you.
So we have a great discussion here, and I think this is also a very new kind of version towards mental health issues that we're going to tackle, because we don't really look at it that way, that there's a correlation between substance use and then of course you've got the issue of mental illness. But first, let's start off with the substance use disorder. For you, how do you describe it?
Well, substance use disorder is actually a mental disorder. So this is a disorder that affects how you behave and how your brain operates, such that you can't operate without taking in substances. And these substances could be anything between alcohol, weed, so there's both legal and illegal drugs. It could be even over-the-counter medication, right? So you've heard of people who are addicted to Valium because they can't sleep, right? So that can quickly translate to substance use disorder, but it always starts with substance abuse. So you start from a point of abusing a drug, and then you slowly now grow to a point of chemical dependency. Without this drug, you cannot survive. You cannot operate at a normal.
And it's interesting because society kind of does like to categorize those who will start misusing or abusing something that perhaps is medical versus that is which is recreational. So it's kind of like, you know, you can't judge me because I'm addicted to like painkillers. But if you are on alcohol and cannot function without the alcohol, somehow your addiction is worse than mine. Wow. And most of these things start slowly. They just start slowly. And that's, for example, if you look at the opioid crisis in America, most of these people, at one point or another, there was even a Netflix series about it. At one point or another, they got injured, they were put on an opioid. Then, because it's very highly addictive, slowly by slowly, they got addicted to it. So even beyond the pain, now you can't function with it. And not because you're so much so looking for the high, but because your body, you know what I talked about, chemical dependency, your body cannot function without it. Okay. You know, to put some context in, especially when we are tackling issues to do with mental health, we always like to highlight the importance of appropriate language or respectful terms. Let me tell you, I was just telling Kadhambi before we started the show how confusing, how ever changing these terminologies are, but I think this is why the experts are here in studio, so that we can actually get it right. The reason I say it's important to, bring this up is because every one of us could perhaps be affected in some shape or form with someone who's in this space. So how do we go about relating to individuals like that? This things are very big, especially in the Western world. And so, Kavambi, tafadhali, how do we go about handling people with behavioral disorders? Examples of wrong terminologies that we tend to use every single day versus what's appropriate. And in this case, because now we're talking about substance use disorder, what do people commonly refer it to as and versus what is right?
Okay, so you've had, and this has been, it's a lot of times you don't say it in jest, it's just loose talk.
Yeah.
It's what happens. And so you'll hear, they're crazy, she's a junkie, so and so is not normal.
You're right.
They killed themselves. They died. Because these days we don't say they committed suicide. Yeah. We say death by suicide.
Right.
So that then you're not, it's the disease that led you to do it. It's not, committed suicide is like they committed murder.
Right, like the way you commit to get married,
yes,
like you purpose
exactly, purpose to do it, but
right.
That's not the case. The reason behind it is not with the aim of death.
Right.
It's with the aim of ending the pain. We call them addicts.
Yeah.
We call them alcoholics. But how we like to say it, number one is even using the other one that I've seen that has become common is using mental health terminologies as a verb.
Okay.
Oh, I'm so OCD.
Right.
Oh, I'm so depressed.
Yeah.
Yeah.
Hey, dude, by
the
the
weather
way,
is so bipolar.
Yeah. Okay, I won't even lie. Sometimes, yes.
Yes. Even I am guilty of,
right. You're like, hey, my boss is bipolar.
Bipolar, yeah.
Right. Right.
That one is too ADHD.
Yeah.
But now we have to start being sensitive, and the importance of being sensitive to how we refer to these situations is to end the stigma.
Right.
Because when you say it as they're an addict, or they're a junkie, or they're crazy, or they're mad, or they're psycho, there's a negative connotation to it.
Correct.
Right?
Yeah.
But think about if you die by, through a heart attack today. The question will be, what was the cause of death? They died because of a heart attack, or they died by a heart attack, or they had a diabetic coma, or so in mental health we are moving to that space.
Right.
So as opposed to saying that one is an alcoholic, Ama, you don't know so and so who has a substance use problem.
Yeah.
So we say they're living with a substance use disorder.
Living with a
substance use disorder. Or they were diagnosed with a depressive condition. Or they're what else? They are, yes, living with or diagnosed with.
Yeah.
It's safer, it's more palatable, it's more receptive, even to the person who has it. So if it's me talking about depression, I'll say, I've been battling depression for X amount of time. Or I've been battling bipolar, or I've been battling schizophrenia for such a long time.
And so words really do matter.
They do.
So it would either, does it determine whether someone will even seek treatment or shy away from treatment based on the way people talk about them? Okay.
Yes, and I've seen it a lot with my patients, depending on how I break the news of the diagnosis. So being a clinical psychologist, one of my fortes is being able to diagnose and come up with a treatment model. How I break the news about your condition, or it's not even your condition, it's a condition you're living with, is very important, is what will determine how you will receive it. And your level of adherence to treatment.
All right, moving on, now that we've kind of cleared the air about that, we want to understand how these two are linked. So when we talk about substance use disorder and the mental disorders, okay, you've kind of alluded to that, but where's the link?
Okay, so I said substance use disorder is a mental health condition. It's a mental illness, all right? However, the correlation between the two is that one can lead to the other.
Oh, okay.
So you're living with a mental health condition can lead you to substance use disorder, or your use of substance use, or your substance use disorder could trigger a mental health condition.
Okay.
For example, I had a patient who presented themselves with attempted suicide.
Okay.
All right. And what we're told is he has been battling alcoholism for a while, and even when he attempted, he was high. So when I sat down with this man, I discovered actually what he was living with was schizophrenia.
Oh my goodness. Yeah.
So he was drinking to silence the voices in his head.
Because it was too much.
Yes.
Like he almost like felt like he was imploding.
Yes.
So for him, this was his therapy.
Yes, that was his coping.
Yeah.
And you'll see that tobacco use, cannabis use will be big with people who have anxiety.
Yeah.
People who have schizophrenia will also be there. ADHD are conditions that could easily drive you to calming.
Yeah.
The calming type of
drug. Right. Yeah.
Right?
And we see that. I mean, people tend to feel like, you know, even when they're seeking treatment, you know, when they talk about medicinal marijuana, what do they always describe that it does for them?
Exactly, it calms them down.
Yeah.
Exactly.
Yeah.
But on the flip side, you being having substance use disorder can trigger a mental illness. Some of these medications can easily trigger psychosis.
Okay.
Right?
Yeah.
So, and the danger with it is you may be able to come back from the psychosis or not.
Yeah.
You understand? Things like alcohol are depressants. So we have substance use, substance-induced depression, substance-induced anxiety. So people who, whereas there are people who will smoke weed with the aim of calming them down, in fact now it worsens your anxiety.
Oh.
Because you're hearing and feeling everything on a higher decibel.
You're super stimulated.
Yes.
Yeah.
So that in itself can worsen the anxiety. So the two correlate. Again, at times it could be withdrawal from a drug that can trigger a mental health condition. For example, this we see especially with people who, which I have personally experienced, is someone who is withdrawing from alcohol. And so this specific person had an injury. They were admitted in hospital. So for the period of time that they're in hospital, it meant no access to booze, right? And then when they went home again, because you're on medication and everything, and you see this is a functioning alcoholic. So in their mind, they're not thinking that I need a drink.
Right.
You're sleeping throughout because of the medication. So your thought of let me go look for a drink is really not there. So what ended up happening is this person started developing psychosis, what we call delirium tremens.
Oh, wow.
You're hearing things, you're seeing things. It's as if you have schizophrenia. Like you, and the treatment for that is you're rushed to the emergency room. And they have to pump you with certain medication to bring your brain back.
Right.
Otherwise, the delay of that could mean you're stuck in the psychosis.
Oh, wow.
Permanently.
Yeah.
The other thing is for some people who the drug triggers psychosis and they're able to come back, the likelihood of them developing a psychosis disorder in future is very high.
Wow. Do you feel that in, you know, just tying on to whatever you've just said, it's got me thinking about people who feel that they need to depend on, you know, things like marijuana and, you know, the whole push and pull. You remember the debate about why we should legalize, you know, marijuana because, you know, it's helping patients, especially those who are in the cancer space. But it seems to me, now I get it, why even health professionals are like, wait, hold up, let's test this a little bit more before we just talk about the benefits, but you're not looking at what could actually be the side effects
Exactly.
of depending on that marijuana to
Exactly.
calm the pain or to just ease the pain.
And marijuana is even not the latest
Yeah.
that's being pushed.
Yeah.
Psychedelic drugs
Right.
are
How did I
also,
forget that?
yes.
Yeah.
So your shrooms.
Yeah.
I can't remember, the shrooms is one that's the most common, but again, there is a push to start introducing psychedelic drugs to treat depressive symptoms,
Right.
to treat burnout, to treat just different mental health conditions. Now, ketamine has been approved
Yeah.
because it's a medical drug and it has to be given by someone who's certified to administer ketamine as a treatment, right? Ketamine is already being used in the system for pain control and things like that. So
Right.
it's also at the moment,
Yeah.
I've seen it in Kenya. There are psychiatrists who are licensed to administer ketamine for depression as well.
Right.
Okay.
Right.
However, as you said, there has to be a weighing. Does the benefit outweigh the pros? Do they outweigh the cons? Right? Because even for example, I'll keep using ketamine because it's what has been legalized, quote unquote.
Yeah.
Before you start your ketamine treatment, there are 1,000,001 tests
Right.
that have to be done. They have to check your kidneys, they have to check your liver function, they have to check your regular HB and things like that.
Right.
And this has to be done also on a regular as you continue with, especially if you have a series of them.
Yeah.
Let's say you've been told that you have to do 6 rounds of ketamine for a period of on a weekly basis.
Yeah.
So every 3 weeks or every 4 weeks, they have to go back and check.
Wow.
Because it
Yeah.
can easily mess up your liver, for example.
Yeah. Yeah.
Right?
Yeah.
So I don't know. And not just with the illegal drugs, even with the legal ones, like alcohol.
Right.
So there are people who you'll find who alcohol has been prescribed. You're told take a shot or two so that you're able to sleep. But think about the long term.
Right.
So you'll take a shot or two today. In 6 months, will a shot or two work?
That's the thing. Now,
So
before you know it, you're already hooked. And this is the problem. I really like the angle that we have today. You know, this gives a different spin to mental health issues. And I love what Val is actually talking about in terms of how each could trigger the other, or the other could cause one to happen. And you kind of ask yourself, by the way, have I already started spinning out of control? It's a good challenge for each and every one of us, especially who are not even aware that perhaps our substance use could be leading to something else and we don't know, or we're trying to cover something that we're dealing with by coping, okay, with substance use. Why don't you let us know your thoughts through our social media platforms at K24 TV. As we take a break, when we get back, we're going to ask her to actually talk to us about the role of nature versus nurture. What's that all about? As well as understanding our role in terms of family and community support. That's also a very important angle as you're dealing with individuals, by the way, who are in this space and require the assistance, okay, and get onto that road of recovery. Stick with us, there's more to come. Welcome back to the show. We're having a great conversation with clinical psychologist Valentine Kadhambi, understanding substance abuse and mental disorders. Well, obviously, in the medical field, they're termed as co-occurring disorders, but you know, we're breaking it down and understanding, okay, what's this all about and how do the two correlate? Well, if you missed the first half, we hope you're going to play it back, okay? But right now, we've got some interesting, you know, theories that she's going to unpack for us, as well as talking about the treatment models out there that are recommended, and not to mention rehabilitation for individuals who are dealing with substance use disorders, okay? It's very sad to see that one could probably trigger the other, or one could be a coping mechanism. And so we were actually saying in the first half, it's a good way to challenge yourself and find out if at all you're on this road, and you might be wondering, okay, am I actually dependent on something, or is something else triggering the way I am? And so welcome back, Val. We were talking about this aspect of nature and nurture and how this ties into substance use disorder. So what do you mean by nature versus nurture?
So nature versus nurture is, nature is your genetics.
Okay.
Nurture is your environment. So which of the two causes mental health disorders or substance use disorders, or is one more likely to cause more than the other? And the answer is yes and no.
Okay.
So for alcohol use disorder, it can be, you can be genetically predisposed.
Okay.
Right? And how we do that is we check your genogram. We go up to 3 generations before you.
Wow.
So it could be Shiko, Shiko's parents, and their siblings.
Right.
First at Shiko, it's Shiko, her siblings, and her cousins.
Yeah.
Then Shiko's parents, their siblings, and then Shiko's grandparents from both sides.
Yeah.
And if you can see a clear repetitive pattern, then you are genetically predisposed.
Okay.
However, for other substances, there is no genetic predisposition.
Okay, so if you're talking about a mental disorder...
No.
This is
substances,
for substance.
Specifically for substances. But for alcohol and other mental health disorders, you can be genetically predisposed to them.
Okay, okay.
However, genetic predisposition does not mean that you must get it. Yeah, it has to be triggered by environmental factors. All right. So you could develop substance use disorder or a mental illness because of environmental factors that trigger it. Right. But because you're genetically predisposed, it means you're more likely to get it if triggered. You understand?
Yeah.
So let me give you an example. You've heard of people who have very high tolerance for alcohol. Yeah. Check your background. Yeah. Right? Because if you talk to a lot of people living with alcoholism, they'll tell you the first time they drank, they didn't get high.
Right.
And their tolerance has always been very high.
But we look at that as a virtue, like we celebrate
as
that.
A flex.
Yeah.
But it's not, right?
There's actually something off about that.
There's something very off about that, right? And then on the flip side, me who doesn't have any genetic predisposition, for example, could go through a traumatic experience that could trigger either a mental health disorder or substance use.
Right.
Yeah. So that's how we look at it.
And the majority of it tends to be the latter, yeah? There's a lot of
the
triggering. Yeah, there's a lot of triggering that gets you to end up in the substance use.
Yes and no. Actually, in my experience, I'm seeing, you know, especially for one, mental health, because we have the theory of mental health, the numbers are going up. Okay. But are the numbers really going up, or are the diagnoses going up? Because our grandparents, you'd be told, even I remember growing up, there's a kid where we used to live who was autistic, but no one knew that's what it was. But now in hindsight, now in hindsight, I'm like, oh my God, that's what the boy was struggling with, you know.
Right.
So I think it's a catch-22, especially because where your genetics also influence your environmental factors.
Right.
So you come from a family of functioning alcoholics,
Right.
which means every get-together in the family, what are people doing? The moment
They're
you
catching
clock
pints.
18,
Yeah.
the moment you clock 18, in fact, in between, you'll probably be given one to taste.
Yeah.
And then by the time you're turning 18, they're welcoming you into the fold of now drinking freely.
Right.
So there's a genetic aspect to it, but there's also an environmental aspect to it.
Wow.
So it is a catch-22.
It really is. And you're so right. I don't know, in compared to so many other disciplines, you would find issues to do with psychiatry, psychology in comparison, still in its infancy, if you ask me.
Yes.
Because I mean, in the turn of the century, there was no such thing as a psychologist. You were called an alienist because you would deal with people who were actually outside the communal norms, right?
Yeah.
So your brain is not functioning well, your behavior isn't like
exactly.
everybody else. So you're an alien to everyone else. So
Exactly.
people who would deal in that space, like you, would be called an alienist because you can only handle crazy people.
And even
Yeah.
then, it was specifically psychiatrists.
Right. Not even psychologists. Yeah.
Yes.
Oh, wow.
Yeah.
Yeah. So there's a lot to learn about this field and this space as to what causes people to behave the way they do.
Exactly.
Okay. So when we talk about whether it's substance use disorder or whether it's a mental health issue that has now creeped up, at the end of the day, there's treatment models, and then you've got centers for this. So are we talking about a rehab or the term rehabilitation for all, both someone who's with a mental illness as well as a substance use disorder, you know, having to either go to do two different facilities or it's the same facility handling the situation? I don't know. It's kind of confusing.
It is very confusing.
Yes.
So what I'd say is the first step is to get a proper diagnosis
Yeah.
of what it is. And part of the diagnosis will be, is your primary diagnosis, is it a substance use disorder or is it a mental health condition? Now, I'm
Right.
separating the two. As much as substance use disorder is substance is a mental health condition. Now, I want to separate the two.
Right.
So the first step is to understand what is your primary diagnosis, what came first,
Okay.
right?
Okay.
Then that influences how your treatment will be. The second thing is, at what level are you? So I like to use diabetes or even a bacterial infection. So you go to A&D and you're presenting with fever, your body is hurting, etc, etc,
Yeah.
right? The first step is to know, okay, this looks like a bacterial infection, or we're suspecting it could be either bacterial or viral. So the first step is to do a blood test
Yeah.
to ascertain what are we dealing with and how high is the infection. What's the degree of infection?
So that you know.
So that you know what medication to give.
And the
Be-
grammage
and
to
the
give.
grammage
Yeah,
to give.
yeah. I get
and
you.
You
Yeah.
see, there are those who will have to be admitted
Yeah.
to take an IV. And then there are those who will be sent with pills for 3 days. And there are those who will be sent for pills for 5 days.
And there are those who are going in for surgery.
Thank you. You understand? So mental health is the same.
It's the same.
It's the
You've got to
same.
look at it in degrees.
Degrees.
Yeah.
So anything above moderate
Yeah.
requires psychiatric intervention.
Wow, straight up.
Straight up.
Yeah.
Because no amount of therapy is going to retune your brain chemicals.
That is a medical situation
Yes.
ASAP. Yeah.
You need to be put on medication to balance your brain chemicals, so that even as we're partnering with you to do therapy,
Yeah.
to deal with the behavioral issues,
Right.
your brain is able to take it in and start making the necessary changes that are required.
Okay, and you know why I think it's so important that, you know, you're bringing that out, because there's probably someone who's watching who doesn't understand why their loved one is acting the way they do.
Exactly.
But then they don't know whether it's the substance use disorder or they don't know whether it's a mental
exactly.
health
This-
issue.
Yes.
So you could be confused. You're just not understanding why Kadhambi is. And, you know, we have those common terminologies.
yeah.
Rebellious, like you said, crazy, you know.
A junkie, an alcoholic.
Yes, but you don't even know. Maybe like the way you said, the one that actually has frightened me is that someone could be living with schizophrenia and they don't know they have it.
Yes. Or they do,
Yeah.
and they're not willing to admit because
Yeah.
of the stigma. You don't know what to call it.
Yeah.
But imagine, Shiko, I come and tell you, you know, why is there a lion behind you?
And I'm like, okay.
You'll ask me, are you okay?
Right.
Are you going crazy?
Right.
There's nothing, there's no, and immediately what do? I retreat. And I'll never bring it up again.
But for sure, in your head, this
I
is
can see it, it's
yeah,
there.
Yeah.
Because schizophrenia, for example, affects your senses.
Yeah.
So you're either seeing, feeling, hearing, or tasting or smelling things that don't exist. Yeah? So we're in a room and I can smell a dead body and it's not there.
Yeah.
So what do? I need to quieten it.
Yeah.
And what do? I'll pick up alcohol, or I'll pick up weed, or I'll pick up cigarettes. And a lot of times we look at people who struggle with substance use,
Yeah.
and we judge them, not knowing that they could be masking.
Something. We brand them.
Exactly.
We just brand them, yeah.
Exactly. So it's
Yeah.
important to understand which one came before the other.
It's true.
Did you have a substance use problem that
Yeah.
triggered a mental health condition, or do you have a mental health condition and you're trying to mask it using the
Yeah.
substances?
Wow.
Then you understand, okay, at what level are you at? So what treatment do you need? Is it
Yeah.
therapy only?
Yeah.
Is it therapy and medication? Is it therapy, medication, and institutionalization?
Right.
Which is where rehab comes in, right? Very many people, especially in Kenya, are very skeptical about rehab
Yeah,
centers.
I know the confidence is not there at all.
And my
for a
colleagues
lot-
will probably shoot me for
Yeah.
saying what I'm about to say. We are yet to have a proper rehabilitation center in the country.
Honestly, even
Yes.
with the top tier ones that we have,
Yep.
okay, I won't mention names, but we
Yes.
all know what we're talking about.
Yes.
Even that you have no
Yes.
confidence in, even as a specialist?
No.
Wow. Why
Why?
so?
The minimum time that one needs to be in rehab for there to be a significant change is 6 months. How long do people go for? A month, 2 months, 3 months, and you're out. It needs to be 6 months, depending again, what
On-
level are you at?
So first of all, the diagnosis in most cases is
Is wrong.
There's a blanket therapy plan for everyone.
In fact, what happens
Yeah.
is this woman will pick her son,
Yeah.
the family will pick their son and tell them this one is an alcoholic,
Yeah.
he needs to be in rehab.
Actually, it's abduction. They abduct people.
So you go in,
Right.
you're focusing on getting this person to stop drinking, but you're not addressing the root cause.
Right.
Why are they drinking? What's the reason for drinking? And then deal with that.
Yeah.
Right? There is a rehab center that I will not mention it, but that their program runs for a year. But it's a Christian institution.
Okay.
So it's limiting. It is limiting to the number of people who can go. The challenges in the rehab centers
Yeah.
here are, one, they're mixed.
So they're faith-based?
No. The one I was talking about, yes.
Okay,
It's faith, it's Christian based. But the common ones we see here are ladies and men are put together. And then what do you expect in such a situation?
Well, I don't know. Is it another version of boarding school?
No, it's trauma bonding. So relationships start
Forming.
mushrooming from there.
Right.
Right?
Yeah.
Something I've experienced is drugs are heavily snuck into this institution.
Yeah, for sure. Because they always feel like I can't deal, I
Yes.
can't cope. But then again, now you have a partner to help you.
Exactly.
Right.
Or
right. So you're
whoever
not
is
focusing on
visiting
your
you,
treatment,
exactly,
yeah.
whoever is visiting you is sneaking in substances, vape, cigarettes,
Yeah.
even drugs, right? The diet that is being given. I know one of the top-notch centers that, for example, allows the people, the patients to take coffee. No stimulant should be in a rehabilitation center because what I experienced is, for example, there's a gentleman who was struggling with drugs and he had ADHD. So what would happen? He'd put coffee in everything.
Yeah.
Like he'd have 10 cups of coffee, and in every cup he's put like 10 sachets. He'll put it in his bread. He'll lick it across the day because he's looking for the high, and it will come. A lot of the ladies there would take coffee for the high to be able, and they'll take coffee across the day.
All right.
So are we really helping?
No, we're not.
And as soon as you step out, is there a program to continue managing you?
Because that's it. And I think, okay, in the 10 minutes that we have, very quickly, is this why you're seeing so many relapses?
Yes.
Because it wasn't effective at all.
Yes.
And then when you get out, okay, there are no support systems there.
And that's where family comes in.
Yeah.
As a family or social support system, are you attacking this person, or are you being supportive?
Yeah.
And even in being supportive, there's a very thin line between enabling and being supportive, being supportive within reason.
Yeah.
So even as the patient is in rehab, the family and the social support circle should be empowered on how to support this person once they're out of rehab.
This is the thing, because you think once I've dumped my brother at your facility, it's your problem.
Exactly.
Me, I've paid you. Just make sure this guy comes
gets
out
better.
okay.
Exactly.
That's it. Like,
and I've seen it.
Yeah,
even,
otherwise, I want a refund.
Exactly. And I've seen it even in my practice, where a parent will bring a child, and I'll tell the parent, I'll see the child, but I also need to see you.
Right. Please.
And they'll tell you, no, me, I'm busy, work. I'm fine. I don't have a problem. The child is the one with the problem, so sort them out. Yeah.
Oh, jeez.
So you work on this child, you're sitting with this child for what? Children, you don't even see them beyond 40 minutes. So you've sat with them for 40 minutes. Then they go back to their trigger for the rest of the week until the next week when they come for 40 minutes.
So it's a waste of money, waste of time. What is your parting shot, Kadhambi, as we say Kwaheri? Because I think we also need to emphasize on the importance of sensitivity around individuals battling mental health issues, individuals who have substance use issues as well. Because it has to start there. If there's no kindness, there's no warmth, there's no understanding, we'll never get anywhere.
I'd like to look at it differently. It's the role of we who have the power. Okay. The mental health professionals, the news spaces, people who are able to send out the message. Because if you don't understand something, you're not going to embrace it.
And you will refuse to understand.
And you will refuse to understand. Yeah. So I'd say first, we have a responsibility. We who are at the forefront of this, we need to put as much effort as possible to send out the message, to sensitize people, to empower people to understand, to show them where they can find help. For example, how many people know that Kenyatta Hospital runs a free mental health clinic for adolescents?
By the way, that's true. Not very many people. I even forgot about that. Yeah, but you're right. Yeah, that's a good question.
And we all pass through Kenyatta, all of us. Majority of us pass through there in training. Yeah. So the same people you're finding in your
practice,
big shot, and your practice are the same people who are in Kenyatta Hospital, right? So there is lack of information. That's number one. And the more we take out the information, the more we go around schools and churches and through social media, through traditional media to send out the message, the more receptive people are going to be, the more sensitive they're going to be. Because how am I supposed to know that I can't say, he killed himself?
That's true. I mean, you know, a lot of the specialists who've come on the show say, look at how much, empathy, support, prayers and what have you we have when it comes to cancer. Why don't we have the same attitude when it comes to mental health issues? You're so brutal, you're judgmental, you don't want to understand, but you hear somebody has cancer, stage 4 cancer, look at the way your attitude shifts.
Work has to be, you see, cancer is very different.
Yeah.
I'd use HIV and AIDS. look at the work
that has been put
behind it
for decades.
And it's still
it started
continuing.
in the 80s.
That's the example I'd like to use.
Right, we need to put in that much effort.
Yes, that is where we need to
posters everywhere,
talk about it everywhere. Every single opportunity you get, share the information. Look at what I've shared today. How many people are privy to this information?
That's why they need to watch K24. Boom. But you know what, this is so important, and I want to wish you well, Kadambi, because even when we look at what's happening in society, it's enough to tell you, by the way, someone needs to talk about it, because we cannot have professionals going off the rails. We cannot have young people turning on each other. We cannot have spouses turning on each other. And it's all because of what you're talking about.
Exactly.
And we need to get to the root of the, the issue. So let me give you this opportunity to let people know how they can reach you. Me, by the way, I'm all about, hype yourself.
Okay.
Let me not do it for you.
So you can find me at Miss Kadambi on Instagram. You can find me also at Niskize. I'm one of the therapists who practices there. Inbox me, DM me, and let's talk. Yes.
All right. If you've missed everything, but the only thing you saw was how beautiful this woman on set was, just DM me and be like, Shiko, who's the sexy therapist? The sexy psychologist, the PYT on the show. But by the way, Usiam's story, Nyingi, she is taken.
Very taken.
But of course, if you enjoyed this particular conversation, you're also motivated to do a lot in this particular space. And even for someone, we want to encourage you this morning to take this information and share it, and even go as far as sending this particular link to someone, or even to those that you know. It could be helpful to someone. A special thank you to our clinical psychologist, Valentine Kadambi, for being here with us today, and obviously to you for watching. Keep the conversations going as usual at K24 TV across the board. My name is Shiko Kaitani, saying thanks so much for watching. We'll leave it there so that Interactive can come up next. They're going to be taking a look at what's trending on social media. Bye-bye. Bye.